I am sorry to inform you that you've got cancer.
What?
This is a situation people fear. Sitting in front of a doctor and being given a life-threatening news like this one. Cancer is one of the leading causes of premature deaths in the world. And I quote, cancer is the second leading cause of death globally, accounting for an estimated 9.6 million deaths, or 1 in 6 deaths in 2018, unquote, World Health Organization. But the problem is, doctors do not know the exact causes. 1 in 2 people will develop some form of cancer during their lifetime, while the Cancer Treatment Centers of America estimates it as 1 in 2 men with 1 in 3 women as being diagnosed with cancer. This program is to inform and educate you in layman's terms about cancer. It is not an alternative to seeking medical advice. What is cancer? What are the known symptoms? Is there anything you can do to avoid it? What treatments are available to a cancer patient? And so on and so forth. Come with me. What is cancer? Simply put, cancer is the uncontrolled growth of abnormal cells in the body. Cancer has hundreds of different types. Some are more common than others. In the United Kingdom, for example, the most common types are breast cancer, prostate cancer, lung cancer, and bowel cancer, in that order. These 4 make up almost 55% of all cancers diagnosed annually. While breast cancer is one of, or the most common in women, it's prostate cancer in men. How does cancer develop? The human body is made up of numerous cells. The latest figure puts it at 30 trillion cells, with about 200 different types, including red blood cells and fat cells. The cells grow and multiply to the body's requirement and order. As cells get older or damaged, they are quickly replaced by new cells. Cancer develops when the orderly process just defined is interfered with. That is, rather than for these damaged and old cells to die and be flushed out of the system to be replaced by new cells, they get out of control and start forming new abnormal cells. And the new cells start multiplying without control. Cancer is a disease which can develop almost anywhere in the body or the cells of the body when abnormal cells grow uncontrollably. Now listen, the cells may come together to form a tumor. The tumor may either be benign or cancerous. Benign meaning a tumor which grows without spreading, or cancerous where the tumor spreads to other parts of the body. Not all cancers form a tumor. An example of such is leukemia. Some of these cancer cells can break off from the primary tumor to form new tumors depending on the type of cancer. If they get to the bloodstream before they are detected, they can travel to any part of the body, forming new tumors as they go in organs and tissues far from where it originated. This process is called metastasis or malignant. When detected and treated early, cancer may not necessarily be life-threatening. Cancer becomes fatal when it has affected major organs' ability to function. Examples could be a breast cancer that has spread to the lungs, or one that has affected an essential organ like the brain. The more cancer has spread, the more lethal it becomes. The speed of spread depends on the type of cancer too. Let's look at the types of cancer. Scientists and oncologists, that is, the medical professionals specifically trained in a branch of medicine that deals with the prevention, diagnosis, and treatment of cancer, categorize cancer into 5 main types based on its origin and forming habit in the body. The first one is carcinomas. These are the most common and usually form solid tumors. They start in the skin or the covering of glands. Examples are prostate cancer, breast cancer, lung cancer, and colorectal cancer. Just in passing, it is important to state here that men can also develop breast cancer, but very rare. The second one is sarcomas. These types of cancer begin in the tissues. Sarcoma can develop in fat, muscles, nerves, joints, blood vessels, cartilage, or in the bone. Leukemia. This is a group of cancers of the blood. Leukemia develops when healthy blood cells change and grow uncontrollably. The fourth type of cancer is the group called lymphomas. Lymphoma initiates in the lymphatic system, that is, the network of vessels and glands that help fight infection. The fifth is the central nervous system cancers, which develop in the brain and spinal cord. There are many other types of cancer, less common and rarer, like thyroid cancer. Not everyone with cancer has symptoms. It is usually detected during a medical test for another issue or condition through colonoscopy or mammography, for example. So the following symptoms are not always present or exhaustive. Fatigue. Fatigue is one of the most common symptoms of cancer. Many things can lead to exhaustion, but where you cannot give a good reason for your regular tiredness, one has to have this examined, as many types of cancer, including leukemia, colon, and stomach, can cause blood loss that you cannot see. This makes you feel very tired. Pains. A cancer that has spread or metastasized can cause pain. Back pain is common with cancers of the colon, prostate, ovaries, and rectum. Pain can be caused by a tumor pushing on the body, chemicals a cancer releases, or is spreading from where a cancer started. If it is an unexplainable pain that will not go away, book an appointment with your doctor. The skin. Can you see a new spot on your skin, especially one that does not look like any others on your body? Quick changes in size, color, or shape? This could be a sign of skin cancer. Any skin changes, including white spots in the mouth, lumps or bumps underneath the skin, such as in the breast, increased hair growth, jaundice or yellow eyes and skin, hyperpigmentation, and redness or dark spots can be signs of cancer. Other signs of skin cancer may also include sores that either do not go away or sores that heal and return. A visit to a doctor is recommended. It may require just a biopsy, that is, the removal of a piece from the spot to check for cancer cells. If you experience nagging cough which does not subside despite remedies, please book an appointment to see a doctor, especially if you cough up blood or you are a smoker. Still seek medical advice even if you do not smoke. An X-ray or mucus sample from your lungs is usually all you need to confirm or eliminate this. Breast changes. Not every change in the breast means cancer, but it is a good idea to pass it by your doctor if you feel any lump, redness, pain, nipple changes, or discharge. Bloating. Bloating is excusable occasionally, but if this is persistent coupled with fatigue, back pain, or weight loss, check it out. One of the main signs of ovarian cancer in women is constant bloating. The fact that it is not only cancers that can cause this symptom, ovarian cancer can be associated with bloating that won't go away, while vomiting can also be a symptom of brain cancer. Urinary problem. Some urinary issues such as weak stream need to go more frequently, and leaks come with getting older in men mostly. These signs are also associated with prostate cancer. Mind you, these are similar to the signs for an enlarged prostate too. This is the more reason why you should see a doctor. A blood test called prostate-specific antigen, that is PSA, may be all you need to allay or confirm the fear. Blood in toilet. If you see blood in your stool, do not just assume it is hemorrhoids, which is caused by swollen, inflamed veins around the anus. Colon cancer and rectal cancer might cause bloody stools. Just as blood in your urine could indicate a urinary tract infection, it may also be a sign of kidney, prostate, or bladder cancer. With stomach cancer, it may be difficult to detect blood loss as this is usually internal bleeding. Testicle lump. A symptom of testicular cancer could be a painless lump or swelling in your testicles. Visit your doctor for a physical examination of your testicle. A further investigation may include an ultrasound. Vaginal bleeding. If as a woman you bleed between periods, it could be caused, for example, by fibroids or some birth control pills. Any bleeding that is not to do with your periods or any bleeding after menopause, such as after sex, should be reported to your doctor so as to rule out cancer of the cervix, uterus, or vagina. You may have noticed or felt some bean-shaped glands in your neck, armpits, and other places in your body. They become swollen usually when your body tries to ward off an infection like a cold. Lymphoma and leukemia are some kinds of cancer which may also cause this kind of swelling. If you have common cold or sore throat, you may have difficulty swallowing. But if it does not get better after a few days, it could be a sign of cancer of the throat or esophagus and around it. Mouth odor. Bad breath and occasional mouth sores or bleeds may not be serious, but when you sight white or red patches and sores that refuse to heal after a couple of weeks, it could be oral cancer. Difficulty moving your jaw, mouth pain, any lump in the cheek must be reported to your doctor as soon as possible, especially if you are a smoker. If heartburn or indigestion becomes habitual, it could be stomach cancer. Weight loss. A sudden loss in weight that you did not plan for can only happen if you have a medical issue, including thyroid problem, stress, or some type of cancer, including the esophagus, stomach, lung, or pancreas. Night sweat. When talking about night sweats symptomatic of cancer, it is more intense as you will be drenched in it. This may either be unrelated to cancer or it may be linked to the early stages of several cancers ranging from leukemia to lymphoma to liver cancer. Everyone has a certain risk of developing cancer. A combination of genes, lifestyle, and environment can affect this risk. But there are risk factors that can increase your chances of developing it. Age. Age is a factor, as people over 65 have a higher risk than the under 50s. In case of family history, fewer than 1 in 10 cancers are associated with a strong family history of it. Eating a healthy diet, keeping to a healthy weight, and being more active seem to reduce your chance by 33%. Smoking. More than 25% of cancer-related deaths are caused by smoking. Passive smoking, that is, breathing in other people's smoke, also increases your risk of developing cancer. Healthy weight. A healthy body weight reduces your risk of cancer. Balanced diet. There is no finding to prove if there is a single food that causes or prevents cancer. A balanced diet should help. Being physically active. Studies have found that regular physical activity can reduce the risk of cancer. Alcohol intake. Drinking alcohol is linked to many types of cancer, including mouth and throat cancers. Drink sensibly. See my video titled Alcohol is a Drug. Sunshine. While the sun is a good natural source of vitamin D, your risk of skin cancer increases if you do not protect it from burning. Being regularly exposed to the harmful substances in the environment or workplace can cause cancer. Carcinogens is the name given to substances that cause cancer. A small number of viruses have been linked to a higher risk of certain types of cancer. They include human papilloma viruses, HPV, hepatitis B and C, and human immunodeficiency virus, HIV. A common bacterial infection called Helicobacter pylori can increase the risk of stomach cancer. There are vaccinations available to reduce these risks. How to lower the risk of cancer? By early detection, period. The good thing about listening to your body and taking appropriate action on time is that cancer is still treatable if detected and nipped in the bud early. It's easier to treat it if detected in its early stage before spreading. In most cases than not, the symptoms may be unrelated to cancer. It is therefore a good idea to get routine screenings. Making some simple changes to your lifestyle, such as not smoking, healthy eating, taking regular exercise, have been confirmed to significantly reduce the risk of developing cancer. Some cancers have no warning signs, especially in their early stages. Pancreatic cancer and kidney cancer are good examples. When it comes to treatment, the options depend on the type of cancer, its stage, and the patient's general health. The main aim is to destroy as many cancerous cells as possible while avoiding damage to normal cells nearby. Advances in technology are making this possible. A cancer type in one individual is entirely different from the same cancer in another individual due to its subtypes. Researchers have now discovered that a single type of cancer, say breast cancer for example, requires a different treatment approach per patient. Treatments are also now available for slowing the growth of cancer cells and stopping it from spreading further. Surgery seems the most favored treatment approach for most types of cancer, as solid tumors can usually be removed. The two other commonly used treatment methods are chemotherapy, which uses powerful cancer-killing medicines, and radiotherapy that employs the controlled use of high-energy X-rays. Other available treatments include immunotherapy, hormone therapy, signal transduction inhibitors, and angiogenesis inhibitors. Clinical trialing is another form of treatment where patients are referred by their doctor to be tried with new developments in treatments. Although researchers have made large strides in their quest to find a cure for cancer, work is ongoing by the day. About 1.7 million new cases were diagnosed in the United States in 2018. Apart from skin cancer, breast and lung cancers are the most common in the US, with over 200,000 diagnosed each year. According to the US National Cancer Institute, over 600,000 people were estimated to die from cancer in 2018, with men more likely than women. It is estimated by the American Cancer Society, ACS, that over 20 million people are expected to survive cancer by 2026. With a bit of tweaking here and there in our lifestyle, we may help keep cancer at bay. A stitch in time, they say, saves 9. Please keep keeping safe and subscribe now for more life-saving tips. I am Prince Larry Adigo, also known as Kabiesi. Thank you.